Okay, hey everyone, hopefully you can see us out there. I'm Dr. Elena Kendi Nasser, Dr. Elena, and this is Camille Canty.
Hey.
She is our family nurse practitioner, so if you haven't met her, Camille, love having her, and she's been a huge help for us this last week, which is kind of a doozy, which is why we're back. So I just wanted to update you. We actually did a Facebook Live a week ago, exactly today. And the big news then was that they'd closed the rodeo, which for Houston really kind of set the bar for things starting to really getting serious in our community. But at that time, so this was a week ago, today is Wednesday, March 18th for future reference, but a week ago today, what we reported was that there were more than 115,000 confirmed cases in the world and over 1,000 cases in the United States. And today, just 7 days later, we're looking at over 200,000 confirmed cases worldwide and more than 7,000 cases in the United States, including at least 64 confirmed cases in Texas and 2 deaths. And so I would say that escalated really quickly. Rather quickly. Which goes aligned with a lot of other countries. And so, of course, we've had mass amounts of information through the media, through all these other entities. Still, the most helpful information is going to be from the World Health Organization, the WHO, and then from the CDC, of course, and the Texas Department of Health as well. So just make sure when you are getting your information, I think, from as trusted and reliable source. We had put on our website a really cool link. It was actually a teenager in Seattle who, at the very beginning of this pandemic, created an actual website that's constantly kind of scrubbing and looking at information and updating the global number of cases and then the cases by country. And it's actually really useful.
It's quite impressive.
Yeah, but it also shows percentage of the cases recovered in the United States. That's like 1%. So we're really still at the very beginning of this. And to be honest, we're not really sure what the next few weeks holds. And I really hope that, a week ago we talked about avoiding mass gatherings and conventions and the rodeo and malls and sporting events. And literally the next day, all of those things were taken off the table. And I think the tide turned when the NBA shut down because Americans love their sports. So once they start canceling major sporting events, I think everyone had this even bigger sense of concern. And then, when someone Tom Hanks, everyone feels like they know Tom Hanks and Rita Wilson, and now they're testing positive. So it really kind of gave this personal nature to it, because I think a lot of us, we look at the numbers and say, well, there's so many million people, and is 200,000 very many? Well, it can very quickly become very many if you're one of those, or someone you love. And so a lot of this is, protecting the people that we love as well, and all of us and those vulnerable populations. So I just wanted to give you a brief update about what we're doing here in the office. So as we told you last time, we removed all of our funner things in the office, which is a small price to pay. We have at this point rescheduled well visits. So we've reached out to you if you have a well visit in the next 2 weeks. We've changed many of them to telemedicine visits because we still want to talk, and there's a lot of things that we talk about during our well visit other than just examining your little adorable babies and children. And the hope is that by April or mid-April, we're in a better situation. That's why we need a couple weeks to see how that's going to pan out. But we really want to minimize your risk and then everyone and health providers' risk as well. So we've already reached out to you. If for some reason you do need a visit, telemedicine is a great option. We've been using it a lot. We also use OMD, which is our HIPAA secure texting app. And if you're in our practice, I know you know about it because it went off all week long. kind of like crazy.
Enough to keep us both busy.
Very busy. So we were both replying, and yes. Dr. Kelly as well. Of course, cell phone access. I'm not going to tell you my cell phone number. If you have it, you know it. Don't hand it out. And then, of course, we're here answering, questions. So if you have a question now, let us know. But even later, let us know. We'll try to answer it and give you the best information that we have and our understanding of the situation. So one of the things that I really just want to stress is that you should presume, Destiny, I think he's going to come in. So we're having a delivery. That you should presume that you have been exposed and that you can expose someone else. And I think if everyone understood the idea of social isolation from that aspect, in our office, thank goodness, it's a very small office, and so we're well less than the 10. But limiting social gatherings. And so what I'm telling the young people and my own family, we have a college freshman who suddenly now lives at home, who didn't live at home a week ago. And then of course we all have some sort of small child, toddler, or elementary, middle school, high schooler who's also stuck at home. But now is really not the time for play dates, for sleepovers, for going to Starbucks and hang out with your friends. I hear there's some sort of spring break party that was going on down in the Gulf somewhere. It's just not the time. And so having large crowds together is definitely defeating, it's not definitely for the greater good. And so we really discourage that. And so it was a hard conversation I had to have with my college freshman Julia, who regularly would want to be with her friends and go and hang out and do things or be at their house and stuff. And I'm like, hey, we need to get the next few weeks. And so it's a little sacrifice now for hopefully us getting through this quicker and with less pain and not overwhelming the healthcare system than if we all just went out. And I think the lessons that Italy have shown, and I'm sure you've all read them by now, that's one of the big regrets, was that the young people really just went out and were still carrying on, and then went to another community and carried on. So it's hard to say hunker down. I do recommend families get outside, exercise, although I will stress not over-exercising. I run marathons and I've done a lot of triathlons and endurance stuff. It suppresses your immune system to overwork out. And so that's how we know sometimes we're overtraining, is that suddenly we're getting more sniffles. So that can lower your immune system. So working out in a healthy way, but getting out, moving, walk outside, that's fine. But if we're gonna walk outside and we're in the same family, great. If it's another family, maybe they're in front of you.
6 feet away,
6 feet.
at least.
Running in Memorial Park, which is a great example. They sent out some, an email that was like, I don't think the public restrooms are necessarily open. They said, do not use the water fountains because everyone just touches them. They really don't recommend you use the porta potty, probably for many reasons, but for that reason as well. And bring your own water. I usually like to run with my own water anyway, because I also don't like using the water fountains. And then space out, so no congregating at the stretching deck like we normally would. And so everyone has a role to play in this, and we felt like in our office we had a role to play too, with distancing, et cetera, of patients. Another thing I just want to mention for sick patients who come to the office, and I forgot to mention this, but if your child is sick, we've found out most of the time, because you've sent us a message through OMD, you've either called the office, which currently is still open, or you've called my cell phone or one of our cell phones, or you've asked for a telemedicine visit. And so we're able to triage really well that way. If we feel like it's someone where we really need to lay eyes and listen to someone's lungs, because everyone still has asthma, people still get sick, there's a ton of allergies out there, kids get ear infections, then we do have a protocol in place. But call us first. We can go down, we can do a temperature check in the car and find out what the story is, and so that way we kind of preserve having a lot of sick people enter. And don't worry, they would be very spaced out anyway.
Well, and also kind of making sure you're the only person who's in the elevator coming up if you are ill, so that other people aren't exposed to you, even if it's not coronavirus.
And so, say you have to go to a doctor's office because you had surgery last week and you need to go to your post-op appointment. Great. If you need someone to go with you, go with one person, one healthy person. But it's not the time to go with your entire family and your three children. And so, because that's what overwhelms the system and just causes more people to be gathered. And, one argument would be kind of the most dangerous place to be right now is probably a hospital.
Right.
Because a lot of the kids will end up going, to the ER, or adults are going to the ER. And so you're going to have areas of the hospital for the people who are sick with suspected cases, and then areas where it's clean. So maybe this person came in and they think they need surgery or something else, but not necessarily someone who's having the COVID-19. So the other thing I just want to remind you is that testing. We've had a million questions about testing. There's really two routes, as far as we can tell, to get testing. One is what I would call the public sector, and one is called the private sector. The private sector would be LabCorp, Quest. These are the normal lab systems that we all use outpatient anyway. It is the swab that we use is the same that we normally send for a respiratory viral panel. So most providers are familiar with it. That's the good news. It goes into a viral culture medium. Has a few little rules, that's different than normal, and is, special test code. Our understanding is that it is reimbursable by insurance. Our hope was that if they didn't have insurance, it'll ultimately be free. We'll see what happens from the government standpoint. So there's the private sector. There's a limited number of tests, and a big rate limiter is the number of swabs. So for example, every clinic you might go to might not have very many swabs because historically you might not have kept a ton of these swabs. And the reason for that is because what these swabs are typically had been used for was a respiratory viral panel which tested flu and parainfluenza and rhinovirus and adenovirus and RSV. So it's basically was this panel of things that we could test for using this swab. But most kids who came in, for example, from a pediatric standpoint, they either had flu or RSV or other. And so we have rapid tests for flu and RSV, and then we have clinical acumen. If your flu test is negative, but you acted like you had the flu, we said, well, you probably have the flu. And the same for RSV bronchiolitis, for example. And then if those things were like, well, it's not one of those things, but it's probably one of these other viruses, but we normally wouldn't necessarily send the test because it was somewhat irrelevant in the well population because kids get over those things and move on. So the point being, we don't have a ton of those tests because we normally wouldn't send a lot of those tests in mass quantities. So our office is pretty limited in the number of these tests we have, and I would say a lot of the community would probably be in that same situation. Plus, you also don't want to overwhelm the testing facility until they're able to accommodate a ton of tests. So for right now, they're not really doing what I call screening tests, meaning parents or adults can't call their provider and just say, I just want to be tested. So you really should still meet kind of some stricter criteria, which is really that fever and cough and recent travel in the last 14 days, international, or known contact, like exposure to a known contact. And I think those part of the rules are about to get really blurred because now that we have more of community spread, it's almost going to become irrelevant because once you have enough of it in the community, it almost doesn't matter if you traveled in the last 14 days internationally or not and you're going to also potentially be exposed to people who don't know or don't have a firm, true diagnosis because they don't have like an actual test that proved that they have COVID-19, but they have the symptoms. So going in that same realm, just presume you probably do have it, and then you want to protect others, and then seek medical treatment if you actually have that shortness of breath, difficulty breathing, and that way it doesn't overwhelm the actual ER system as well. Our understanding in the public sector, Harris Health System, the Harris County Health System, is going to be having drive-by testing soon. I think I've heard it.
To be continued.
Yeah. I don't know when. I can imagine the line. I don't know the exact rules of it yet. I'm sure there's still not going to be necessarily screening tests, meaning you still should have symptoms that prompt you to get into the line. And so the most important thing, and the other point I'll make about getting into the line to get that test done, is it takes the person doing the test wearing what's called PPE, or this personal protective equipment. And that involves, or it should involve, what's called an N95 mask. It is a very uncomfortable mask that really needs to be fitted. Having any problems, and actually stuff is getting through. A face mask, gown, and gloves. So that's a lot of stuff. we are so low on those resources that they've now recommended health providers reuse the N95 mask, which historically would have been kind of a one and done. But now they're having people hold on to them and keep reusing them. You're in a situation where normal clinics aren't going to have all these face masks, because normally we wouldn't need all these face masks. And so there's just not enough PPE for providers, and healthcare providers are a very vulnerable population, because if the healthcare providers get sick and then transmit that to the people at the clinic or at the hospital, and then not only do you not have enough ventilators to treat patients, but you don't have enough people to work the ventilators.
Right.
And so that's where it becomes, rather difficult, for the community as a whole. And so there's a lot of reasons why when people call and just ask, hey, we want to get a test, and we're like, we're sorry, we just really can't do that, but here's why. And there's a lot of resources and I think helpful links, and we can add some of those. So if you have questions about that, or you feel like maybe you meet criteria to get tested, please let us know, and then we can help direct you, as best that we can. One thing that I do want to stress and just remind everyone is that from a pediatric standpoint, in general, this is still felt to be a mild illness for most children. And I think little kids run around, they constantly have a runny nose, and they constantly cough. By the way, kids cough all the time. And
it's allergy season too, so
and if
keep that in mind.
Yes.
If you're going and playing outside.
Right. If you walked outside, it's bad today. So all that yellow stuff falling onto your car is really, wreaking havoc as well. So I feel like a lot of the city already has some of these symptoms, right. But the difference is they're not having that fever and they're not having that difficulty breathing. So really this differentiator is I have fever and I'm having a difficult time breathing. I think those people really should seek, medical attention and call their provider and get guidance from that aspect. So just remember, the good news is pediatrics, we feel like we're probably in an okay place. Now, could they end up being vectors and we just never test all those kids and it turns out they were carrying it and passing it to grandparents? Absolutely. So we go back to the whole thing we said before. Just presume you have it, and you don't want to pass it on to anyone else, and that's probably the best way to do social isolation. Be careful in that grocery store. Make sure you wipe down the stuff when you get home from the grocery store. Yes. Importantly, things they've also said, it does not transmit through the mail, and there's and so like Amazon packages the mail, they don't feel like it's transmitted that way, because I think I've had some of those questions as well. So as a whole, can you think of any other questions that we have had that we haven't answered?
I would say just really kind of think about the healthcare providers whenever you are buying Lysol and face mask and gloves and things like that, and only really buy the things that you need, because there really is a shortage in clinics as well as in hospitals. The fact that they're having people reuse masks is actually quite outrageous.
Yeah.
That's what puts healthcare providers at risk for developing it is.
Yeah, it seems that it's very contagious, and it's spread by virtue of practically breathing.
Right.
And so they really were in the hospital having to reserve those N95 masks for people who are doing invasive procedures,
right.
Who are intubating, doing CPR, which is when, we normally would wear some sort of protection anyway, as opposed to, they're allowing them to even just wear surgical masks, which probably is not adequate enough protection, but it's just limited resources. So it comes back to what we have that's available to us. So anyway, we're going to try to not overwhelm the health system. Please make use of telemedicine. You obviously know our number because a lot of you've called, which is great. And we always say, don't worry alone. So if you're worried, give us a call, or if you're worried, call your healthcare provider. Any other questions, feel free to put them in the link. And a week from now, we will meet again, at least on this exact particular numbers. And I'm hoping that the numbers, while I know they're going to go up, hopefully we're not seeing that they're on the exact same exponential rise, and some of these measures are starting to take a little bit of an effect. Thanks for joining. We will see you later. Wash your hands.